Hey, my name's Brad Stevens. I'm shooting a little selfie video here. Actually, Dr. Miller just left, and I told him I wanted to give them a testimonial because this machine and his knowledge saved me a ton of medical challenges. Long story short, I'm 38 and ended up having a herniated disc in my lower back and causing major nerve pain all the way down my right leg. I mean, just tremendous. And went through the path of orthopedic, and then they sent me to PT, and it didn't really work. And then going and get these spinal injections, these steroid injections that kind of relieve the inflammation to stop the pain. Um, but it just was still not getting better. And my only alternative was this micro discectomy deal where they like actually go in and cut part of the herniation, which is part of your disc. And ended up getting to learn about Dr. Miller and this IDD therapy and this piece of equipment here that I've been become really good friends with over the last couple months. And it's basically an opportunity with the disc, with the herniation that kind of pops out of the disc, the soft inside pops out and pushes on the nerve. And what this does is it's not traction. It's a machine that very specifically targets and isolates. Mine was in this area called L5 in my S1 nerve, and you get on the machine and it oscillates back and forth, and it kind of brings the health back to the disc and helps to absorb that herniation. So it released that pressure. Because my alternative was getting this discectomy cut, cutting off the herniation. It's going to create longer term issues in the other vertebrae in my back. Once you do that, there's scar tissue, and they say that it's very low reoccurrence, but the more people I've talked to, I realized there's actually a lot of issues you can deal with that surgery longer term, and it works its way up 5, 10, 15 years down the road. And so by using this, it's a machine called AcuSpina that they make that does this IDD therapy, and sit in it and does this pulsing, and it has now removed the pain. I've got these spinal injections, do the steroid to release the pain, so I can have an opportunity to do some treatment like this. So then when it wears off, actually the herniation is taking the pressure off of the nerve. And that's finally the stage that I'm at, and was able to avoid having to do back surgery by using this IDD therapy.